with the Guam Nurses Association. We have Dahlia Sapalo. I hope I said that right. She's
Sapalo.
Sapalo. She is an oncology nurse
Yes.
navigator with Guam Cancer Care. Thank you, Dahlia, for joining us. First, just if you could explain what is an oncology nurse navigator.
Okay, well, it's a pretty new field of nursing. It actually was started in the 80s by an oncology surgeon named Dr. Harold Friedman. And what had happened was he noticed that cancer patients were facing, in addition to their diagnosis of cancer, they were facing other difficulties, such as financial, transportation, and access to medication. So he started the oncology navigation program. And basically what nurse navigators do is just that. We navigate patients through the spectrum of their cancer care. So beginning with, say they have a suspicion that they may have cancer, or maybe they have a family member with history of cancer, they'll go get screened, and they'll go through the tests, and say they come back with a cancer diagnosis, they may not at that point know where to go or who to turn to. So what we do is, they come here and they talk to us, and we help guide them through what they need to do next so that they don't miss any steps, and so that their care is optimized.
And what made you go into this particular field of nursing?
Well, I had worked at GMH for the first part of my career, and I was ready to transition into another job. Just because of personal reasons, I needed a more stable schedule. So it just so happened that I was having dinner with a friend of mine, and her friend had asked, had mentioned to her that there was an opening at Guam Cancer Care for a nurse navigator. So I quickly looked up. I'm like, what is a nurse navigator? Because I didn't know either. So I looked it up and I said, hey, you know what? This sounds awesome. I looked at Guam Cancer Care and what they did, and it was a pretty easy transition, just because the work that we do here, it really helps all the cancer patients on Guam, and not just cancer patients, but we also have a really strong screening and prevention program, because that's also an important aspect of cancer, is we want to prevent it as well.
Has the services that you provide changed since COVID?
Actually, we haven't closed our doors at all since the start of COVID. And it's because a lot of our patients and the services we provide, even though, COVID is very dangerous, but however, they still have cancer and they still need help. So, for example, one of the things that we do is we provide supplies, and say a patient has oral cancer, and they can't eat normally, right? So we actually provide Ensure Glucerna, and that may be the only thing that they can eat or drink, and we provide it for free. And so, what would happen if we were to close down? Then they would have to pay for their Ensure, their Glucerna, and it would be safer for them to come here to our office, just because we changed our procedures such that, in terms of prevention, so that they wouldn't have to go to a crowded grocery store, and risk being exposed out there. They could come here for their Ensure Glucerna. And again, it's free. Also, another one of the services that we provide are pharmaceuticals. So a lot of cancer medications are very expensive. For example, one bottle of medication for prostate cancer costs about $10,000 for one bottle. So who can pay $10,000 out of pocket? No one. And if we were to close down our doors, they would not have access to, getting these medications, and their cancer would progress. So we felt that, it would be a disservice to our patients if we were to close down.
Right.
But in terms of making changes, one of the things about cancer patients is they are immune compromised. So way before the pandemic happened, they were already practicing the infection prevention.
Right.
So, we still practice that here. And instead of them coming inside, we bring them out to their car. So we have a curbside assistance.
Dahlia, I want to ask because two of my mom's sisters passed from cancer, and her youngest sister, Auntie Jeannie, had gone, and I mean, because it's kind of like you kind of do like, I mean, for lack of a better term, it's almost an onboard service, right? When people get the diagnosis, they come, and then you kind of help them, like you said, navigate through all these different ways to get care, what kind of treatment's the best. But what's it like when you meet these people and you help them figure out how to fight this disease, which I hate cancer. So I've never hated anything more in my life. But what happens when you get these people and you tell them how to fight, and then later on you find out that they lost that fight?
That's one of the most heartbreaking aspects of being a nurse navigator, or even being a nurse in general, because of course we do the best that we can to help them with their fight. But sometimes it's just, like you said, cancer is such a horrible disease that they can't, they lose the fight. And we support the family as much as we can emotionally, and we learn how to, we try not to let that get to us, so we have to practice a lot of self-care and a self-awareness, and know that, what, as long as we do our job, we've done everything we can to help them, and we've supported them 100%, then then we're okay. We'll be okay. And then, and again, that's why we focus on prevention and screening, so that we won't have to go through that so much anymore.
Is there ever a point where you question what you do because it seems like so many people lose this fight to cancer? Is there ever a moment where you just break down, where it's a kid or someone like Zaxon Nicholas, or just, people who fight the disease in a dignified manner or not? I mean, does it ever break you?
No, I mean, things like that actually make us stronger, and it really gives us that reserve to continue to fight, to continue to provide this help for our cancer patients, because we deserve so much. Everyone deserves the best care that they can possibly get, especially on Guam. This is our island, these are our people. We deserve the best we can, and we can't give up. We shouldn't give up.
Thank you for that. We're getting some calls and comments. How do people get a hold of, not necessarily you, but, Guam Cancer Care, and if they need to kind of get these services, what's the contact? How do they get a hold of you guys?
Our telephone number is 969-2223. We also have a website. It's called guamcancercare.org. And you'll have information on the services we provide. There's a way for you to directly contact us. There's also a screening tool. So I encourage everybody to take a look at our website, get on that screening tool, and see, what it is that you should possibly be screened for. Because when caught at the earliest stages, cancer treatment is so much more effective, and you'll have better outcomes. Yes, the screening tool is absolutely free.
Okay. Thank you, Dahlia. This has been a good talk here, and we definitely commend you and appreciate the work that you do.
Thank you.
Stay safe.
Wash your hands.
I will.
Okay. All right. 9:03. We'll take a really quick break. But before we do, you want to do this pizza giveaway?
Okay.
All right.
Let me find